home. Start making arrangements for where are you going to get that baby from? Where are you going to deliver that baby? Because here you are not coming. Pretoria West, you are not coming.
In our government,
We don't want you anymore. Start making arrangements where you are going to deliver that child, because here we don't want you. Yeah, you can go into Ramaphosa's house.
The reason why we are here today is to enforce Section 17 as per our Constitution, where it stipulates that when you want to use the clinic, you need to be a South African citizen and a valid taxpayer. So we are enforcing the foreigners and the undocumented foreigners per se not to use this facility, because once you enter South Africa legally, you get medical insurance, which gives you the authority to go and visit private hospitals. So making a stand here today is to let these people know that we are tired. We cannot stand for this anymore. We are tired of private work. Overwhelming of people entering this vicinity on a daily basis. And when we look at the statistics show that 95% of the people that is visiting this vicinity is foreigners. So that is why we are here today, to enforce that specific section by letting them know that we had enough. This is not going to happen on our watch anymore. We will march and march until we win. We are going to be here tomorrow. We are going to be here on Wednesday. We will be here for how many days it's going to take to make them understand. Take your children, take yourselves, and go to a private institution, because you have the medical assistance that is required there. Stop taking the bed, stop taking the medication that is rightfully there for our South African citizens, not for you as a foreigner.
To their own hands, but also as the Human Rights Commission, our mandate is to promote the observance of human rights, but also educate people on where those human rights stem from. So we did so to remind the general public that in terms of Section 27 of our Constitution, everyone within the borders of South Africa has the right to healthcare and access to healthcare.
You know, the human rights activists, they need to come clean and come out and tell us, who are they? Who are they actually supporting, and who are they advocating for? Because to us it looks as if they are advocating for foreign nationals. Now I'm saying this because in many incidents, you know that we had kids that died of poisonous food. We did not see them. We have kids that are being raped by foreign nationals. I mean, we see it on all social media platforms, but they are nowhere to be seen. But immediately when you touch the issues of foreign nationals, and then they come out, they even have the audacity to take us to court. Now, we are, as Operation Tutula, are the mouthpiece of South Africans, and nobody will stop us, because we cannot just sit back and watch our country going down the drain.
From today, Mama South African, South African.
Please. South African ID, ma'am. No foreigner inside, Mama. Not even one. We are not accepting. No, as from today, you don't go to any clinic in South Africa. Take your money, go to the doctor, or go to a private hospital.
Danville Clinic, today it's day 87. Day 87. This is our reception. We have 4 people. Just look how clean it is. Only 1 person. Dispensary 0. It's so clean. It smells fresh. This side, we have 1. We have 3 this side. And this side is empty. Here we are. The Mbokotos are doing a very good job. We're going upstairs. We are going upstairs to check how many patients we have. Here we are. this side, it's 0. We have 3 people, 3 patients.
Political parties do not actually, or members of the public, do not actually deal with the systematic issues in the general public healthcare system. Then we have this issue where we are fighting, or the general public is fighting for limited resources. And these systematic issues speak about the aging infrastructure in healthcare, the high levels of vacancies, of course, and the unavailability of medication when people go and get healthcare services in clinics as well as hospitals. So those are the systematic issues, and the amendment of the Constitution won't address those systematic issues. What will take place is, we hope that in terms of the National Health Act, those systematic issues are dealt with, but also we have financial backing to the Department of Health to ensure that everyone who is entitled to healthcare is given healthcare.
Yeah, in light of what you've just said now around the limited resources being available, is there, though, a case to be made that on the basis of those limited resources, and I think there's common cause around that, that perhaps maybe it is too expensive to implement the ideals that are in the Constitution, and therefore we may need to revisit it?
Based on that, it's not about the Constitution. Once you start amending the Constitution, which is founded on the values of dignity, humanity, and the underlying principle of Ubuntu and treating people with those the same way you would want to be treated, that doesn't deal with the systematic issues. Amending the Constitution won't immediately give everyone access to healthcare, everyone else access to adequate education. And that is why the Constitution speaks about the progressive realization of these specific rights. So it won't really deal with the systematic issues, these amendments. It will simply mean that we are amending the Constitution, allowing certain people to have access to certain rights, and therefore, because of the way the South African borders are, allowing those who really need our help, the most vulnerable members of society, to then suffer because of these amendments.
Yeah. But again, Commissioner, isn't there a case to be made when we speak about the suffering of people, that amongst those people would be South Africans as well, the same South Africans that would have gone to the poll to go and cast their ballot, that gives legitimacy to the politicians who are currently governing the country. But what they find is that you have longer queues that are at these health facilities because government needs to also provide the service to foreign nationals, and the pressure that it applies on the healthcare system as well. So South Africans themselves are being disadvantaged by the Constitution.
South Africans are protected by the Constitution, and that is why we have a constitutional democracy. The difficulty then is hiding behind the Constitution and saying it is the reason why we are in this dire situation, instead of addressing the real systematic issues. And this is why the Commission is reminding South Africans of the importance of our Constitution and the importance of adhering to that Constitution, as well as the legislation that stems from this Constitution.